Might be multitasking. Jenny, are you available?
I think I hear something. We're echoing.
Oh, there she is.
I'm here.
You want to introduce yourself?
Yeah, I'm Jenny Stevenson. I am the school-based health team supervisor for Deschutes County, and I am here covering for Shannon Brister.
Thanks for being here.
It's like Lee.
Hi, Lee Butler. I'm the clinical supervisor over at Ben Treatment Center and board member. We've had connectivity issues. Sorry for being late.
Eric.
Good afternoon, Eric Keniston, just management analyst for data analytics, just listening in.
Thank you. Cameron.
Hi, everyone. Cameron Fisher, OSU Cascades, and family members with IDD and ASD.
Callie.
Hi, everyone. My name is Callie Rumley. I'm with Pacific Source and the behavior strategist.
Okay, thanks, everybody. We need to approve our March 15th minutes. Approve those minutes. There was okay. This is not yet.
I'll second it.
He is like, and we get to vote on it. We heard that last one.
Yes. Right.
So, all in favor?
All
All right. Get that out of the way.
You have to ask for opposed too.
Anybody opposed to that? And by the way, you can go onto the county's website and watch the meeting from last month and you'll find out what you just approved. You don't remember. Any announcements? Anybody have any announcements for the board? Across? I had a couple questions. One was from Cameron asked a question about some of the stuff that Captain Schultz talked about last month. By the way, he's excused. He's at a department head meeting for the county. He did call and shared some information with me on what their MAT program, how it's doing, and things like that. Cameron's question was more around what behavioral health is doing, and this happened as I was trying to figure out how to answer her question. That Holly showed up on the Board of County Commissioners meeting on Wednesday and gave an excellent explanation of what's going on with the behavioral health side of the response to measure
House Bill 4002.
4002, right? Come up with that. So get an opportunity to go look at that. 12:30 or 12:30 minutes into the meeting until about 38 minutes or something. About 20 minutes talk. Very, very good explanation of where we're going with that.
Complicated to explain. It's complicated to explain, so I'm glad it.
That's right. You can't do it in less than 20 minutes.
No.
What I heard is that according to Andrew Doyle, who works through the DA's office, it's only going to, his opinion was that it only would impact maybe 50 to 100 people.
Well, it depends on how we design our program.
Okay.
I think our district attorney is open to, so the legislation only requires it for people who have been charged with just possession of small amounts of drugs. But if you develop other deflection programs across the state, lead programs, oftentimes will consider other small, low-level crimes like property crimes and things that are often due to somebody's substance use. Also eligible for deflection. So it just depends. I think if there's a link to their substance use being the driver of their crimes, of the low level crimes, our district attorney has shown an openness and willingness to explore, not so that we can capture the right people, so that we can get the right people into treatment and offer them deflection. So, yeah, so it could be more. We're yet to be seen.
Okay, thank you. Yes.
Balanced Bend, which is a mental health fair that we're.
You can speak up a little bit.
Sorry. Oh, sorry. Balanced Bend has been canceled this year. It's something we participated in last year, but they are unable to put it on. So.
I have an announcement too, not through St. Charles, but through the kind of collective work of the Central Oregon Health Council. There's a substance use disorders work group that's been going for the last 4 years. And we started out with $2 million and we've spent most of that. And we're down to our last 358.337 point something dollars to spend. And we just released a grant, an RFP, and we got 11 applications back. It's basically to focus on prevention and reducing as a response to like the fentanyl crisis, really focusing on prevention and education in schools. I think we've had a couple of districts apply, Cleveland County applied, Deschutes County applied. So we'll be approving those. And then last week we approved like $20,000 for naloxone for like Bend Fire and Rescue and different organizations. So just on that hopeful note of like, there's lots of good funding and work happening in response to the opioid crisis.
The things we like to hear.
Yeah.
What else is going on besides what we know about?
Yeah.
Hey. Moving right along, we'll turn over to Paul.
Yes, so next month, this board had expressed an interest in getting an update on our IDD program, which I'm happy to deliver in May. And I wanted to make sure that rather than I just choose what content it is that y'all are interested in, that I invite some input in terms of what bullet points you'd like me to kind of cover. Because I can certainly talk for a long time on multiple subjects, but none of it might be very interesting to you. So like to, and I have, you know, kind of I jotted down a list of some things that I thought folks might have interest in, but if folks have input, I'd love to hear it, and I'll put together a presentation that caters to what your interests are.
Have ideas.
Yes, please.
I would love to have you talk more about the intersection of IDD and behavioral health.
Yep.
And how we can help people better navigate those services without one saying, no, it's because of that, no, it's because of that.
Perfect.
And make it more of a holistic kind of full, coverage. So that's one thing. I think the other thing I would love to hear is if there's anything innovative coming up. I feel like, and I could be wrong, I'm certainly not involved day to day, but it just kind of chugs along, and I don't know if there's some new ideas, new connections, new programming, just new stuff coming up. I would love to hear about that as well.
This might sound silly, so be prepared. I don't know how to put it, but I'd love to know what a typical day is like with their services, how they impact them in their life, sort of thing. That's what is missing for me I love this presentation. I wanted, but for your program, I'd really like to hear about that. And I don't know if they have family or support people, how it all comes together. Is that bad?
Too bad. But I would also say there's probably no typical day for.
Exactly, that's why I'm like,
experiences.
but you know what I mean?
Services.
Yeah. How, like without services, what it would be like, and then with services, right?
Sure, could maybe even line out a story for an individual, of course, de-identifying, but at least an example of a person's experience through our service. Would that help?
You said it better than I did.
Paul, I was just at the Roscoe Rodeo 2 weeks ago, and High Desert Stampede was here, and those kids, so many of them got on a horse, and what a difference it made. And one of the kids, I said, "Oh my gosh, you've got to get him into Healing Rains," and she said, "We've been waiting for a long time."
Forever.
What?
Forever.
Yeah, forever. And I said, and they were like, they were so funny. And I go, you don't understand. I have a relationship with the people at Healing Rains. And if there is some way that we can expand that part, I'm not sure about Crystal Peaks if they do. Larissa, who works for me part-time, works at Crystal Peaks. But if they could expand those programs to see those kids on a horse and what a difference it makes and all the things they were doing. I mean, it takes your breath away.
Well, and it's interesting because Healing Range was one of the recipients of
It was.
the Behavioral Health Resource Network dollars. So
Yeah.
anyway, it just might be some opportunity to see what expansion they provided with those dollars to serve.
It would be interesting now that they open now that Tumalo is open, because I know when we were in wraparound services, my son's therapist talked about that a lot. There was just no way to get in. And I mean, it's just such a long wait list.
So that's really good feedback for us to share in our burn partner meetings, because I didn't know that.
I have all kinds of feedback.
Yeah, well, yeah. Okay, bring it.
I mean, sadly, they do.
No, I just think it is so critical because I know what my horses do for me
Sure.
on a personal level. And, I kiss them every morning.
I mean, I think that falls into the category, Commissioner, of things that are, resources within our community, and how do folks with an intellectual developmental disability access those resources just like anyone else? And sometimes it's purely a capacity issue that any kid has trouble accessing that as a resource, and people with IDD are no different. Sometimes it's a disability related access challenge.
Well, I know that Phil Knight underwrote a lot of their Dust and Diamonds event last summer. I was at it and he was the first one to raise his paddle to donate more money to the program. So
Fantastic.
I'm thinking, just have to run into his wife, right? And say, could you guys, could the program actually expand more? Because they do have the Tumalo location now. We really need that. It's so impactful.
I think it would be nice to, Paul, and I know you know probably about a lot of them, but I think there's maybe some disjointed or there's not always a lot of connections about what's available in the community for kids with IDD. Ben Park and Rec does a great job. They're fantastic, and we're able to use some of the money for my son's support person we can use towards therapeutic rec camps, which is super cool. It's a very great program, and he's made friends, and that's a huge deal. But there's some other different programs too that are smaller and just getting started, and I think those
How to learn about those community resources that are out there.
get that tie in.
I think my brother has something.
I think there's, I really look forward to your presentation, and as we're talking about with access to care and things, there's also the fact that the large burden of filling the cracks and helping support everyone through lifespans on the family. And a large number of folks, especially older IDD individuals, have parents who are getting to be elderly. What's the plan to support these folks with what they can have and the problem solving or the brainstorming down the road when those family supports really are going to begin to hit their limits as they get older to fill in the cracks or even be the supports to help get them in the door for the large group with elderly family members supporting them. I'm really interested in that sort of long view with that project or with that department.
So Lee, I was struggling to hear you accurately. Are you wanting us to kind of address how to fill that gap as individuals with IDD are aging and then entering more into senior kind of needs?
Well, not just the individuals, but like how are we helping? What are the services and supports and plans when their support system is also elderly and growing? Like when the family members at home are 60, 70 plus for a 30, 45-year-old individual, right? Something like that. Because that's a large sort of unspoken thing in a lot of the general dialogue on this topic is the family side and all that stuff. So thank you for clarifying, and sorry for my.
No, I got you. Thank you. Thanks, Lee.
Okay.
That's great. That helps a bunch.
Melinda, what's on the agenda?
Okay. Oh, yeah, so today you've already been introduced to our three guests. I work in education. I'm an education lawyer and I do a lot of special education work. And so as I've sat in some of these board meetings since I've joined this board, it feels like this is a critical piece for everybody here to understand the impact of behavioral health and mental health in our schools. And because in my estimation, I think we're at a pretty critical place, near crisis situation in some respects. And so I thought it would be important to have you all hear what's happening in the schools to add a piece to the puzzle that we're all addressing. So they've already introduced themselves. I'll just turn it over to them. Thanks for coming.
Thank you for having us today. Really appreciate it. I'm going to go ahead and start off, and my colleagues will add more details. And Kira here is going to bring us home at the end. And I just have a few things to talk about. I think the first thing to remember about public schools is that we serve all students. We serve all students as they walk in the door, no matter what their disabilities are, no matter what their mental health needs are, no matter if they're homeless, no matter if they are in poverty, no matter if they're wealthy. We take every child that comes in our door and we serve them all. We are not allowed to never have enough resources. We're not allowed to never be able to serve a kid or say, we don't have room for you. We have to find ways to get resources, even if we don't have them. People treat us like we're an unlimited resource, even though we're not. We have real hard limits on the staff we have and the expertise we bring to the door. Our job is to educate kids and to remove barriers to their education, remove barriers that could help them access their education. When folks come through our doors with a mental health condition or any other disability or anything they might have, our goal is to help supplement that child, help work through them, and help them access the education. This puts us in a pretty interesting place because we have folks walk through our doors that we simply have very little resource of how to work. We don't carry the expertise. We don't really have, where we have counselors, we don't really have mental health therapists. While we have occupational therapists, I don't have doctors providing physical therapy. There's lots of things that we do in an educational setting. Because of that, we find ourselves, for lack of better terms, being taken advantage of, and putting ourselves into places that cause us to get in quite a bit of legal action, actually. And Linda and I spent a lot of time talking on whether or not we're able to provide the resources that students need. Now, I've been an educator for 29 years, and I've worked in a variety of different places throughout Oregon. Mostly worked in rural Oregon and done a good portion of my work down in Southern Oregon. When I was in Southern Oregon, I was assistant superintendent of an ESD down there. One of my main functions was to interact with the Douglas County mental health system. That was a while ago. I know they've gone some trouble since then. And then when I was working as a superintendent up in Yamhill County, I did a lot of work with the Yamhill County behavioral health system and the interactions we have through them. But I'll tell you, between the two agencies, I have often run into a real culture problem with how we work together. Simply because schools always have to work with children. Schools always have to have the resources for children, and we have to have them right now. As you work with behavioral health organizations throughout the state, behavioral health organizations tend to operate more like doctors' offices, where you make appointments, people come see you. Therapist has to have enough room to have you see people. It's a matter of resources, a matter of how much you've got. Our problem in schools is that we always have to serve students, no matter what. A couple different things have happened lately, and behavior, and I know you all see this, mental health conditions have spiked among our student population. Lots of different ways: suicidal ideation, anxiety, a lot of anxiety, a lot of behavior that's very aggressive. In fact, in the last 4 years, injuries to my staff members from students has gone up 290%. 290%, because of the severity of students that come into our doors, and we really don't have the resources, the clinical resources, to treat them. because fundamentally we're educators, we're not clinicians. But sometimes we get put in the position of having to be clinicians. And that really is fundamentally the problem, if you will. As an example, we've had a couple group homes move into Redmond lately, run by the Cornerstone Corporation. And they're a difficult group to work with. They hire, I guess I would say, kids into their organization to run at apparently at a minimum wage kind of area. It's very hard to figure out who's actually running these places. Either calling them to ask for help or calling them to go through that. Their business model appears to be that schools are their daycare program. And students will come in from around the state. They'll move into the area, and each home handles 3 to 4 kids, so they're not massive. But the students that come into our schools are so resource intensive. Sometimes takes 2 or 3 people to work with them. We have a child in one of our schools who comes in and spends every day trying to bite our staff members. We have people in full protective gear trying to work through that. We have hitting, we have biting, we have headbutting, we have screaming, we have lots of different things that happen. And they're not, untypical for different kinds of conditions. But the group homes provide no resources. They don't come and say, we brought this student into you and we are a professional organization to take care of them. And we're gonna send a nurse in with you or something like that. No, they come to our doors and say, here's the child. You keep them for the 6 hours a day, 6 or 7 hours a day, and don't call us unless you're gonna expel the child. They literally kind of have that attitude. And it's difficult for us. It's very difficult. It used to be last year up to this year that we could limit a student's day. We could say this child really only can thrive in our building for 3 hours, and then you'll need to go home. With House Bill 819 Senate Bill 819, we can no longer do that. We have to serve a child the full day, no matter if we have the resources or not, no matter if it's good for the child or bad for the child. And the group homes will come in and say, they're yours. We have lots of parents who move in with children with significant disabilities. They very rarely come at the beginning of the year, so we can staff up appropriately for them. Often they come in typically 2 weeks late, sometimes 3 months late, after you've done your hiring, after you've set up for things, and in comes a student, and it's like, oh, here's a child you'll have to deal with right now. And sometimes we'll ask a parent, is your child on an IEP, an individual education program? And they'll look at us and go, special ed? No, never heard of that. And then we get their file 3 weeks later, and it's this thing. And we come in and we've been trying to work with the child and probably not fulfilling their IEP because we didn't have any knowledge. We've been in legal action a couple different times of how we work through these things. Fundamentally, we need help. Fundamentally, we have a need that's quite beyond our capabilities. And that is the amount of how do we get students more mental health services. It's difficult to get our kids into mental health services. It's difficult to get them in RAP services. And when we do get them in RAP services, very rarely will the parents allow us to talk to therapists so we can coordinate. I think of the 5 children we currently have in RAP services, only 1 parent will allow that communication. And it's fundamentally puts us at a disadvantage. Fundamentally puts us at a different space of how do we coordinate with other professionals to make sure we're doing the right things in the right places. So lots of things with that. We find quite a few barriers of accessing mental health. And this isn't, I'm not here to cast blame. I'm here to kind of point out some real issues that we have. We have a hard time getting kids into services. We have a hard time getting students the therapy we think they need so they can thrive in our spaces. When we need to get a student into Sagebrush, which is the more advanced conditions to get in there, you can't get in without the right kind of insurance. If a parent is unwilling to connect and be part of it, they're too extreme to go into Sagebrush. I understand why that is, because the child may or may not have the degree to be able to be successful in that space. However, when a student is too extreme for Sagebrush, which happens, they're still back in our schools. We still have to be able to do something with them. And that creates a fundamental problem for us. Fundamental problem of service. And like I said, I'm having a hard time keeping staff members. They're very quick to go, you know what? I'm really not into having somebody hit me every day. I'm really not into being attacked. These kind of things are happening fairly often. So that's if I can set the stage there, is fundamentally sort of the issue. I would consider it an issue of culture between some of the agencies, simply because in education, it's right now, all the time, serve every child. Every agency that we interact with, be it private, be it public, has a limit. Everyone says, well, we're not taking kids right now, or I'm not seeing those kind of patients right now. And which is great for those agencies, but for us in schools, that's just simply not how it is.
I think we actually have more in common than you think, because we actually do not have the ability to do that. There are certain fidelity programs that have models that the state does not allow them to have more than so many kids in. But as an agency, as this community mental health program, we, like you, also have to serve right here, right now, anyone who wants our services. So very much can align with that, and also can really empathize with your workforce issues, because as you can imagine, we too, the acuity in the community is rising. And as a provider like you, who has to serve everyone any time that they need it, those can certainly create some workforce challenges as well.
All right, I'm gonna go ahead and turn this over to my colleagues.
So I'm Jennifer Houth, and I would echo similar concerns and issues here with mine. He mentioned many of them, but just that increase that we've seen, this is my third year with Pine, but we continue to see that increase in externalizing and internalizing behaviors. We've had, as I'm sure you've seen, the union concerns that we've had around in our classrooms, and this last contract season, we've had to add contract language around student behavior. But again, it's just about that student need and us serving all students all day. But then kind of with healthcare and mental health, it's a choice whether the parent accesses that in the community, but they come to school every day, which is great, and we welcome them, but we really are lacking resources. Even after significant investment that we have in our student success intervention, putting clinicians in our schools for therapeutic dosing, regulation, break spaces, again, but not to provide mental health therapy. So I just kind of quickly threw some data together this morning, but we currently have our student success intervention in 28 of our schools, serving 300 students. We have a partnership with the High Desert ESD and the Nest, serving 12 of our highest needs mental and behavioral health students. We have a wait list. We also have our in-house secondary student services, serving 17 middle and high school students with IEPs with significant mental health and behavioral needs. 35 students came back this school year from a higher level of care, and that's typically in the Valley, doing a residential or substance use or eating disorder. We do have students going to Utah and other places as well, but they transition from 24-hour care back down into school, and usually 1 hour of outpatient a week, which is for someone that's been in 24-hour residential care. We have our students as little as 6 years old being hospitalized for 5 to 10 days in the emergency room, waiting for beds. I just spent 5 hours in the emergency room with my own daughter, and the thought of one of our little first graders being there for 10 days waiting for a bed. I mean, the things that we saw just in the 5 hours, I can't imagine as a mom experiencing. Since December, we've had 33 students in the emergency room in their stabilization center for suicide attempts and suicide ideation. We don't have all the data because, as you know, we only get the data if an ROI is signed. So sometimes kids are just showing up with the bracelet on their arm, and we can ask them whether they've been in the hospital. But St. Charles and the stabilization center have done a great job really trying to communicate with us and with other districts. And that's just been in the last year. We haven't had that before. Again, just that increase in anxiety and depression, and those increase in suicide risk screens. And then, as you know, just some of the recent losses in our own community, I'm sure that you've heard about. We have a partnership with Care Solace. This is our second year. We were finding a need with care coordination and just how to get students and families into the services that they need. So we partnered with Care Solace. And this is our data just from this year. As you can see, anxiety is still a prominent issue for our students and our staff. As well as depression, ADHD, disruptive behavior, marital suicide, eating disorders have been on the rise for the last several years, as you know, and then you can see there. We continue to see gaps in our mental health services. We're serving students in our in our schools who really need a higher level of mental health care, which we're not able to provide. And even as we build those relationships over the 12 to 18 months with these families, trying to get that care coordination so that they will access Deschutes County, it's still a choice, and many of them have distrust of the system and experiences that they've had in their own lives that they don't want for their children, and so they will choose not to get services but still want to come to school each day and not get the support that they need to get better. It's true with medications as well. The student success intervention, it's meant to be a short-term support for students kind of coming out of residential partial hospitalization and provide that kind of check and connect home base within the school. But we're finding that it's needing to be medium to long-term over several years, which wasn't the intent of the intervention. And in the data that I shared previously, we have low numbers of students coming from a higher level of care, but it's because we don't have that option in the community. And so we believe that there's many more students that need a higher level of care and have surpassed whatever Sagebrush can provide. But we really lack that continuum of care in the region. This is kind of like a identified needs kind of wish list, but we need some more intensive outpatient programs. We need more IOP. Right now, we currently just have youth villages and RAP. If we're gonna look at kind of referrals to Sagebrush, you know, a lot of the feedback we get at school districts is that we're referring kids that are too acute. But then what is it before Sagebrush if these kids are all too acute, but they're within our school day? And that's what we have. This is what we have. I would say we need more partnerships with the schools outside of the school-based health center model. We currently have that in two of our schools, but having therapists within the school that are clinicians and have the supervision and the support from the county. We know from research that students are 6 times more likely to access mental health if it's provided within the school, but we are not mental health clinicians nor a facility. Having a therapeutic day school model in the region, is everyone familiar with what that means? I come from California, so there was a larger continuum of care, but I really see that need for a therapeutic day school in the region. Also a child and adolescent psychiatric inpatient unit. I feel like we desperately need one of those in the region for our students, so they're not spending these 10 days in the emergency room, typically sometimes on gurneys in the hallway. And then some sort of regional alt-ed program around substance use treatment. I definitely feel as a need in the area.
So just to piggyback on that, so there's a lot of work actually happening around several of these things. So there's a group of people that have been working on this for a while, but there's actually some momentum. There's land identified. There's an organization that's willing to come into the region, and we've got state involvement. And so it's got some real momentum, and the goal, child adolescent psych unit, but also potentially a crisis respite for youth, as well as potentially day treatment. Like, so all of that is in the works right now. And I think we've got more momentum than we've had in years around it. And we actually, the resources have been the tricky part around it because those facilities come in at an astronomical cost, but there's an organization that actually has its own resources that is willing to come into our region and build it. So I finally have some hope that it might happen, because the last price tag was like $34 million and nobody had that. So there's real momentum happening. And then I think with school-based health center model, you know, the resources from the state to actually expand those to, you know, has been a challenge.
Yeah, and I've had several meetings about the school-based health center, even if it was just a therapist from Deschutes County that could be in our schools, so that we don't have to have that red tape. And those models are great, but they're harder.
I actually ran that model when I was in the animal camp.
Yeah, I mean, if the resources, I think if we, you know, if the state would fund those types of model, or even just resources to embed people in the schools, I mean, that would be, you know, but it's just they have not invested in the child services array and the level that they should have, as you all know.
Yeah, and part of, you know, my work.
Jenny? Oh, Jenny's our school-based health center supervisor, actually, and she's on the, she's behind you on the screen.
So Jennifer, we meet all the time. I know, I know you well. And I will say one of the biggest things that we have been struggling with, again, is the ability to hire enough clinicians and the cost of hiring those clinicians, right? The mental health expansion grant for school-based health centers did not increase this year. It actually decreased for Deschutes County because we have 2 medical sponsors now instead of 3 across the 7 school-based health centers, and it's based on how many or who your medical sponsors are. So we actually had a decrease in the amount of funding for mental health expansion grant, which is what pays for our school-based health center therapists. And you know, we have child and family positions that are open for months on end, and we're not able to get providers in the door and hired who to even fill the slots we have right now. So it's definitely, I think a funding issue is a big deal right now.
Yeah, thanks, Jenny.
Yeah.
I mean, we are experiencing that as someone who oversees hiring, like I'm in interviews this whole afternoon. I was in them all day yesterday. So I hear that as well. We have expanded our MOU partnerships with Trillium. We're now looking at Thrive. So we're looking elsewhere. But we just have a need and we need support.
In my role is just kind of summarize. I did want to speak into Sagebrush just a little bit because I'm in my High Desert ESD role. We're the educational partner for that, and would love to see an expansion of that, but know that again, workforce and funding limitations at the state level means that year over year our capacity in long-term care and treatment is actually decreasing. I know that's true at both the partial hospitalization model as well as the residential model. They've reduced capacity over time, which has made it even harder then for our families who are willing to access that in the Valley to be able to get connected. We are really excited though, because when we look at the progress over time, you know, prior to Sagebrush reopening as Sagebrush, it was a much smaller capacity and it was only elementary. So we have seen growth in our region in the few years that I do want to recognize as really impactful, and it's due to a lot of collaboration by people even on this team and with schools. And so when I reflect on that collaboration and the strength of that did more than double capacity of long-term care and treatment in our region. So I really do think that as educators, we have a role in a strong partnership. We absolutely want to serve kids in our schools, but we just are not health providers. And so trying to share the message with the legislators and the people who make decisions and fund us that they see a place for mental and behavioral health care in our schools, and we absolutely do too, but we aren't healthcare, we're educational providers. We aren't trained clinicians, we aren't treatment providers. And so I see it similar to if one of our students had cancer and went to an oncologist and they said, oops, we're full today, or we don't have staff, or we have a waiting list back to your neighborhood school. We would never be expected to be the treatment providers. We would absolutely accommodate for the condition and meet the health needs and create safety conditions so that children can thrive and have access to education, but we don't treat the cancer itself. And I really firmly believe that mental and behavioral health care deserve that same level of respect, that the clinicians and the treatment providers should be doing the treatment, and we as educators are removing barriers to make sure that to the greatest extent possible, every child has access to what they need in our schools. So from my perspective, our doors are wide open, and we need the mental health clinicians, and we can't hire them any more successfully than you can, of course. And I'm most recently my past few years was serving as the special education director in Jefferson County, where I was really excited to see the strong partnership of Best Care in schools. And so I saw that model and saw the great success that meant that parents didn't have to leave their job to pick their child up and take them to an appointment and then bring them back to school. And so that is a nice step towards a more seamless system, and absolutely support that too. So just my message is our doors are wide open. We want to partner. We want every child. We want to stay in our lane of being the educational providers and get out of the way so that the mental health care and the behavioral health care can do their role too. So
I'd love to say something as a parent who has a kiddo who has an IEP, who has been at Sagebrush, who's been at Step Up, and is doing really great right now. So I'm very grateful for all that. So I do think it's great. I do the idea that therapeutic day school, I mean, some kids just need something different, and there aren't alternatives available. Would I put my kid in something different? I probably would, because it's pretty lonely right now, right? But so I think that's something. I know it doesn't we look a lot of times at like crisis kind of end of things, which is fair. But if we did some other stuff earlier, we wouldn't have as many of these crisis things. So mom piece. The other part is he also accessed wraparound services. I'm like, I've touched everything. So, which were also phenomenal. We were fortunate enough to get in. We were fortunate enough to get into Sagebrush. It wasn't easy, all of it. But I literally had to quit my job because of all the appointments. Sagebrush, you have to engage regularly. Wraparound, you have to go. And I wouldn't change what we did for anything because of how it's turned out. But I don't think it's a choice for every parent. So saying parent's choice or they're not engaging, a lot of times there's reasons, whether it's, I mean, you mentioned trust, there might be something, and that's true, but some people work 9 to 5 and the therapist's phones are off before 9 and after 5. I found that out. I mean, that's literally their rule, right? They can't have their phone on. So you're talking about people who work 9 to 5 and their kids are at school, you know, and they might in these shortened days. I know that's hard for a lot of families. It's just, I think it's just a big picture, not to forget the family. It's hard on them, super hard. And so the resources are hard for them to find, and it's kind of like trying to uncover a secret to figure out what's available. That was the hardest thing. And then, you know, we had a little difficulty between like the behavioral health component and his disability, and saying, oh no, that should be covered under wraparound. No, that should be covered under his IDD services. Somebody should just cover it. It shouldn't, you're right. We don't want this kiddo to be living on the streets, to be incarcerated, to, you know, all these things, getting, you know, being that kid at school that's biting or kicking or hitting. We don't want that. Nobody wants that. So it's trying to figure out how can we, there's so many pieces. There's the workforce piece. There's the cost of living here. So you have to, many families have to work multiple jobs and they don't have time to engage your background or do the therapy sessions with Sagebrush. Or go to their IEP meetings.
So Danielle, if we get legislation that actually is impactful for this tremendous need, would you be willing to like testify?
100%.
Yeah, no, I mean, that's what we need. We keep fighting it, you know, as county commissioners, we're always supporting this. And you've got to all like make your testimony be heard from different, like Melinda, where you said you're an attorney and you're seeing what's happening. I mean, this is so sad in this state that our kids are at the bottom of the nation and it's not going very well.
Yeah, absolutely, I agree. And I think I'm able to see it from a lot of angles, and I feel for the school staff. I get that. Sometimes it just sucks, right? There's not the resources and you have to do it. And sometimes it sucks for the parents because you don't want your kid to go there because you know they don't have the staff to support your kiddo in the way they need. And not that it's their fault, but there's no other option. So what do you do? And, you know, or like, and, you know, wraparound only lasts for so long before you're graduated or I get kicked out because I'm like, wait, my kid's doing good. Don't kick us out now because what's going to happen, you know? So, and I understand why. I mean, it was explained to me multiple times when I thought about it, as you should. So I think we do a disservice to where, and you know, it's hard to talk about the funding, and I think this is important, Patty, but a lot of times where our funding is going to crisis services and we have the need, and I see it here, if we could invest in families and young kids when issues start rising, we wouldn't have to have so many crisis services. So having those supports available.
Yeah, we really need prevention. And honestly, when the first COVID shut down, I said to Governor Brown, I said, well, can we do summer school? Because those kids are going to be so, and she just kind of looked at me. But I said, like, let's get these kids back in summer school. And you see now, you know, a couple of years of no school and all this in and out. Yeah, it's really.
Well, prevention in general, I mean, it's been just something underfunded at the state level.
You know what resources? Okay, like there's nothing you can do to prevent my kid's disability. Right? He has a disability, and because of his disability, he faces some mental health challenges that comes with, you know, they are hand in hand things for him. So it's like, what's available? How can we wrap around you in whatever way, you know, when they're little, so that they feel comfortable at school? He wasn't early on, and he has a lot of school trauma because of it. So And one other thing with my Mosaic hat on, and you will probably know, but if not, that there was federal law, I think it was Wyden, that helped push through that now there's more Medicaid available for.
So we're
the
working on
therapy.
developing a viable Medicaid system. We've
Okay.
been at it for about a year. And I think we've managed to get $7,000 in reimbursement. at this point.
Spend it all in one place.
Aside for the advisory board.
And you know, and that's hard. And again, it comes back to a fundamental misunderstanding about schools. Is that Medicaid is generally paid for direct service, where you serve kids in medical ways, and we don't really do that. I mean, a little bit here and there in terms of, we have a student that's got a feeding tube and we do that stuff, but we're not generally providing therapy. We're not generally providing, you know, we advise on physical therapy, but we don't do physical.
And
therapy.
Medicaid billing is complicated.
Yes, and so, I mean, I've invested in a person to work through that and kind of be that person. I'm hoping to break even on it this year, and I'm clearly losing money at this point. But the idea of trying to be able to access Medicaid is a huge possible funding resource, but walking through the maze to get there is very difficult.
Have you met yet with,
I think we have some hands up too.
have you met with Wyden's aid
I have.
locally? Okay.
I'm talking. I mean, I had to tell her about a school psychologist doesn't do therapy. They test. They test to help work through things. And there's a fundamental misunderstanding about what schools do and what medical providers do. They're very different things.
That's why I thought that funding was kind of funny.
Well,
Because
there are schools in
there's a
the.
school-based
There
health
are
center.
schools that are accessing that. A couple, and that's Albany, I think, ends up getting about $600,000-800,000 a year. Corvallis is similar, but it's really trying to figure out how to figure out what you do to build. And so we're working on that.
Ellie, you have your hand up.
Yeah, thank you. I just appreciate the connection to the school district because there's obviously a lot going on, and disseminating this information is really helpful. I'm curious if there's any movement or flexibility in the school district to sort of contract with the ABA providers in the area that are trained to really deal with those challenging behaviors that in their clinical setting, they're often serving individuals with autism, but it's a science that can be applied across IDD. You don't necessarily need an autism diagnosis for that method to work. And I know in other states that I've worked in, this is the clinical background I have, the school districts contract with ABA providers so that they can come in and consult and provide just another psychology lens on how to respond and just navigate some of that really challenging behavior. So I'm just curious if Ben Lapine is open to that, if they're talking about that, if there's an avenue for that to happen.
Now we have one contract with an ABA, and I know that I've just hired my first ABA into the student success clinician role, which is, I've never worked with a person with that background. So I think we're flirting with it. I don't think we have like a full-blown contract where students are accessing those types of services on a daily basis. And again, those all cost money, right? And come out of the general fund, which, but yes, we are aware, and we don't think there's a ton in the area. But that's a great idea, Callie.
Yeah, in other states, they would wiggle around the payment. So if like a child was receiving ABA through their insurance company, then like the ABA provider could come in contracted through the school with an agreement, and then that ABA professional would bill the insurance company for spending those hours at the school with their client. And then that ABA provider in their insurance contract with the insurance company would say, I'm serving this child in the school setting or in the home setting, or, you know, in a community-based or place as well. So there is other states that have that model pretty hammered out, like Florida is a big one that's doing it. So I would just like suggest, if it's not being discussed, to really look at that avenue, because that's such a helpful way to like manage some of those challenging behaviors, because that's really what those professionals are designed to target.
I think that's interesting too, because I was thinking about when we were in wraparound services, our therapists would sometimes come to the school in Redmond And so you were getting the wraparound services, but during school time, and that worked really well. I don't know if that's an avenue for getting
A
that.
lot of things are possible. When I was superintendent at Yamhill Carlton, we had a great partnership going with Yamhill Behavioral Health. And we hired folks, we paid half their salary and they were full-time in our schools. And we were providing therapy that way with students. We actually replaced counselors to do that. We wouldn't do that now, but that's what I did then to be able to afford it. And it worked pretty well. It really created a streamlined system, and it actually worked into the summer as well. Because sometimes students still need help in the summer when they're not with us, and they would run a summer program as well. That worked pretty good, and they were able to bill enough Medicaid through sometimes we even got free services out of that because it covered as many students. And so that really was a pretty good model, but it has to be defined and kind of laid out.
Lee, you got your hand up.
Yeah, thanks. I worked for a long time at Rimrock Trails with some of those, real high needs folks that had other issues, and when they got their school together, they also did well in the clinical setting. So school is important, and it was one of the things that led to success coming home. And as a parent, we're starting that process of the 504 with my kid at John Tuck, and just for the Redmond guy up there, been great with that staff. And I hear and I echo and I understand those macro system concerns, and I believe we're all on board with those needs and agreeing on that. More on the ground, whether it's elementary or whatever, how much collaborative problem solving or restorative justice on the ground in the classrooms in entire grade levels potentially, like how much of that is happening either in RSD or a specific area as in addition to the SBAs and all those things, but that can be done or have been shown to work in other settings.
We've installed what's called the Bright program in all of our elementary schools and secondary as well. That we're doing an adjustment next year on that. Their basis is collaborative problem solving, as well as sort of training the brain and teaching kids to work through trauma issues. So it's a pretty significant part of what we do. Restorative justice, we use more at the elementary level than we do at the secondary level. We use it pretty significantly with drug and alcohol use in terms of working with the county's Upshift program. And then we have a great partnership with Rimrock Trails to bring students directly to them, or sometimes Rimrock comes to us as well for drug and alcohol services. So we do quite a bit of work with that.
Awesome. Cool. Thank you.
Boy, what a fun discussion. Just looks at the clock. Mentioned to Patty earlier that I forgot to bring my phone, which is my clock. So I have to turn around and look back there.
I mean, but what a important discussion today.
Right.
I mean, you feel the need. Something's got to change.
What can we do as a board? Any ideas?
Yes, and no, we're ready for partnership, ready for innovation. Dollars matter, but one of the challenges, we aren't a mental health system, and so we don't always know what to do with dollars that are meant for mental health needs and behavioral health needs, because we're educators and we're not a mental health system. So we need partnership from the health system angle to be the treatment, so that we can be the educational lane and that kids can get both, because they need both. And it's we know they're not successful without both. If they don't get access to education, we know the horrible outcomes there. And if they don't get access to mental and behavioral health, we know the horrible outcomes there as well. And so I think it's not a pointing fingers or pointing fingers. We just need partnership, all of us together, so that kids turn into the amazing adults that they can be.
Cameron, got a hand up?
Yes, thank you. Roger, I liked your question of what can we do? And I'm just going to throw this out. Those of you who are in Ben Lapine schools in the zone for voting, make sure that you take a look at the levy that's on the ballot, because A portion of that will be focused on addressing behavioral issues and safety issues and mental health issues with our kids, particularly in Ben Lapine schools. So vote May 21.
Yeah, I would encourage you to vote for the levy. And then also, I think it would be great if we could put together some sort of work group or task force. I'm not on any kind of steering committee or advisory panel that is actually working on the issues within Central Oregon around our mental and behavioral health from with a school's perspective and the county. So it seems like we're all working on the issues of the students and families, but I'm not sure where we're coming together to collaborate and problem solve.
I would echo that. Really, we only have a limited amount of funding with all of our agencies. How best can we help each other? How best can we maximize the work that we're doing? How can we build energy off each other so we can serve kids together? There are barriers between our agencies. Can we knock them down? Can we find ways that we can really build strength with each other? And to me, I think that's the place to start.
I could see that when Holly was talking about the work that they're doing to try to bring a center here, and school districts didn't seem to know that.
Yeah, I've heard about it. I'm pretty excited.
Yeah.
Yeah, but it's like that collaboration, right? Like,
Yeah.
Yeah, that piece I think is probably missing. We need to focus on how to do that, but what you were talking about from a parent's standpoint, I attend, I don't know how many IEP meetings every month, and all these conversations happen about, you know, what are the resources in the community, whatever. Sometimes providers will come to the IEP meetings. I've been doing this for over 5 years now, this with a special education focus. And I'm sitting here and I feel like I'm a reasonably smart person and I'm still overwhelmed about what the resources are. And you know, what IDD services does, what behavioral health does, what, you know, CareSolis does. I don't know, as I sit here today, what all the resources are, and I don't know where those lines are. And so I do wonder if there is an opportunity to create some kind of a service countywide at least, or statewide, like a care navigator, like these are your resources. Here's what each of these agencies do. Here are the contact information. Here's how they're supposed to work together. Here's, you know, stuff that you need to know, because I don't think parents have that. I sure as heck don't know. And I don't know, maybe you guys know better than I do because you live it on a daily basis, but that's a gap and that's an area that I think should help.
well, and that's one of the reasons we partner with CareSolis, because we don't have, you know, our counselors have 400 to 500 kids on their caseload, and to spend 4 hours with a family helping them navigate care and the referral forms by outsourcing it to CareSolis for that warm handoff, and then they do all the phone calls and figure out insurance. We had to get that off of our counselors' plates so that they can focus on serving students and not doing all the, I mean, sometimes you have to call 12 therapists to find the one spot that has the opening, and we don't have the bandwidth for that.
How's that going? I've been curious about the CareSolis. Are they indicating they're having success in navigating these services for families?
Yeah. I mean, we have data, and I mean, I know for us, it's saved us hours and hours and thousands of emails and communications, and yeah.
Our experience with CareSolis has been good. I would say that if any ways, it gives people hope because they get on a list. At least they know they're on a list to get through
At least
there.
they know they're.
And it still takes them a while sometimes to get services, but at least they've got a pathway. And so
Yeah.
I think it's been helpful.
And I think there's limited in-person services here, so it gives them an option if they're willing to see someone in Portland, it gives them that virtual option, which before we didn't know how to navigate all that. And so now it's just like we do the warm handoff. They work with the family, they find the therapist in Portland. If they can't find anyone here, that can get them in within a week or two. So, and for us, it's been great.
That sounds really good for some services, but I don't think it connects with everything. You know, if you're talking about a kiddo who has an IEP or they have a disability and they need to navigate, you know, as well as mental health. And, yeah, so I like
This
the
gives a lot of the
idea
lower level stuff off of our
a
plate.
Central Oregon based kind of care navigation
Like
type.
centralized place for a
Yeah.
family to go to figure out what resources are there instead of having to figure out all out.
Because things like this, but they're in, so there's like.
If you think about the work of FAN locally, for instance, right? FAN is kind of a broker of services. It gets people to where they need to be and does direct service. You know, something along those lines would be helpful.
They just raised $118,000 last Friday with their luncheon. Yeah, it was really amazing.
certain things, but they're not gonna get you to sagebrush.
I was-
But you mean that's.
I just
Yes,
example that
yes.
style. yeah.
No, I agree with you. I agree. Because there's like,
Hey,
you know, CODSN can navigate if you have a disability, but if it's not disability based, then there's multiple other.
guys, I'm fighting this law from 61 years ago, where the mental health hospitals have to be 16 beds. And 16 beds, it is not cost effective. And anyway, it's from 1963. And I'm just like, oh my gosh, Wyden was supposedly working on it, and then it seems like it's kind of stalled again. But definitely it needs to be changed. So it's all
And more than half the states have asked for whatever the word is for relief of that.
right.
But Oregon has never asked for that.
Yes, we live in a special place. We have to work especially harder, Roger. You need to work harder.
Okay, thank you. Thank you very much. I mean, this is a great discussion.
I would love it if they came back, if we could have like feedback in like the next 30 days. If there's anything positive you have to report, and if there's anything that you guys see that we can pull together, just just a brief little 5-minute feedback. I mean, if you can't be here, but maybe one of you could.
Linda's there. She's on the board.
Yeah.
On our board.
Yeah, just to know, okay, is there anything and what should we really be doing? So we can actually get it accomplished next spring if we can help.
Put together some of these,
Partnerships, pulling
Right.
it
Together.
together.
and I don't know how to do that. I don't know if that's my job.
Ernie CIO, Sharon.
I said it's not hers.
I owe you a phone call about Cornerstone.
Yeah, I'd like that. We have a lot of frustration with them, with the organization. And we're upset that it feels like they're bringing students from other places, and some are local, with a very high level of need into an area that doesn't really have the service. And that's been very frustrating. I'm not.
And the lack of personal care for children, personal connection. They're mini orphanages. It's not homes with caring caregivers that are connected from a parent sense. That's my biggest concern.
Sure. Linda, since Julie's not here, we went through that time frame pretty quick. Put you off till next month and talk about this.
I can do it really fast too, about 2 minutes, because we don't have a lot. So I think we're talking about the student member of our BHAB. And so Julie and Jessica and I met, and Jill Adams wasn't able to make it for that meeting, but she'll be able to for the next one. We're still working through some processes. I think we have some quick recommendations that we'll be making, but we're not prepared to make them yet. But we're thinking we'll start with one student and probably the college age student, and see, because they would take less work and be a little bit more independent. And so we still like to talk about a high school student. We'd still like to talk to the high school student. Julie and I and Jessica are new, so we don't know who that was or how to get into touch with that person to find out what their feedback is, because I think that would be pretty useful. We think that we need to be doing this for like a 9-month or 1 year school year term to match up with their experience in their school. We do think about having an application for students to express their interests, and so I can help out with that once we get closer to it. And we would probably expect them to attend monthly meetings, attend speed to events that we support. And then we'd love to have them do an exit interview so they can give us feedback on what our program looks like from a student perspective. And then in exchange, we'd ask them to come in and, give us their perspective on what's going on in the schools from their lens. I think the idea is that they would actually serve as a board member, but we will have to work out some issues with that, with the bylaws for the terms of board members, if we're only going to have them be there for 1 year. So that it's kind of a area that we'll need to kind of work out a little bit more. And so that's kind of it. We have another meeting coming up next May, or this coming May, next May. It's a year, we're really slow. Julie McFarlane has a meeting with the OSU Cascades representative, the academic program coordinator for the Masters of Counseling, to talk about what does this look like from the school standpoint, the college standpoint, like what would they like to have some of their students do? So that's kind of what we're thinking right now, but we're going to be meeting more and we'll bring back more recommendations as we fine tune some of these.
Okay. The only thing I was gonna point out is all that we have a committee basically set up in our bylaws. We have never staffed it, I guess. You guys kind of may be that now. It's called the Membership and Onboarding Committee. There's several duties there that this, I think, would be one of them to bring those issues back to suggestions back to the board. Another one that is part of that, the duties of that committee is recommend board members for nomination as advisory board members and also as chair recommendations for officer. My term expires at the end of the year, so.
No, you can't leave.
The end of which year? Like the calendar year, the fiscal year?
Calendar year.
Oh, well.
Just thought I'd bring that up.
Oh, Roger,
Are you hinting at something?
No, I don't want to influence any questions, but I do want to see a nominations committee.
I nominate Roger.
Somebody seconded.
Right, let's get on it now.
I think we've reached the time to adjourn. Is that right? Thanks for coming. This is really great. I don't know how we're going to put this
We have to make a difference.
group together.
I'm not gonna let another year go by without getting something.
Who's going to be in charge of that?
Action figures.
Like
Roger.
It almost sounds like it's in Amber's area.
I haven't seen it forever. You were like brand spanking new.
You know.
Thank you so much.